Have you ever tried to translate an idea from one language to another and realized that conveying the same meaning isn't easy? Well, you're not alone. Differences in language makes communication across cultures challenging. For instance, in Japan, saying "I'm sorry" is a way to express goodwill, while in North America, an apology is taken as administration of guilt.
Verbal communication styles. Each language has its own unique style that distinguishes it from others. When one tries to use the verbal styles from one culture to another, problems can arise. The first verbal style we are going to consider is directness. According to anthropologist Edward Hall, two distinct cultural ways of using language are low context culture versus high context culture. Text cultures, they use language to keep social harmony. Using high context messages, they abstain from directly saying no, especially if it would threaten another person's face. Communicators will also talk around the point, allowing others to fill in the missing pieces. This allows for ambiguity and the use of silence to be the norm. Middle Eastern cultures fit this pattern. On the other hand, low context cultures use language to convey thoughts and feelings. Using low context messages, they look for meanings in the words. Communicators will use eloquent speech to express their point of view and will state views directly and strive to persuade others to accept it. Unlike high context cultures, silence is seen as a sign of incomprehension. High and low context communication in healthcare. Sick patients use high context communication styles. On the other hand, low context communication style is used by clinicians. Case 1. Here we have a doctor giving his patient his diagnosis. In low context cultures, time is accurately measured and promptness is valued, while in high context culture, the passage of time is more flexible. In this first case, the physician rushed and did not explain Mr. Sims' diagnosis thoroughly. From Mr. Sims' point of view, as a patient, which is a high context communication style, he will feel that adequate time was not spent in addressing his issue. It is important that both sender, in this case the physician, and the receiver, the patient, share the same understanding of the context, or else communication will fail. The second verbal style is succinctness. In native cultures, the way to handle ambiguous social situations is to remain quiet, whereas in many North American cultures, talkativeness is commonplace. The third way languages differ from one another is through formality and informality. Learning conversational French, you must understand when to use the term vous, which is the formal use of the term tu, which is used in familial settings. However, formality or informality does not just encompass grammar, but it should also reflect social position. It is understanding that cultures use different words for the different sexes, as well as for different types of occasions in all social settings. Language and worldview. Since our world is full of different languages, theorists have come up with linguistic determinism. It is the theory that languages shape thoughts and knowledge. Edward Sapir and Benjamin Whorf have formulated a declaration of the linguistic determinism. They hypothesize that languages that people speak and use influences how they interact with the world. Linguistic barriers occur in the healthcare setting. For instance, when the healthcare provider does not use or is familiar with the patient's language. Case 2. A 10-year-old Hispanic boy came to the hospital with flu-like symptoms. His mother only spoke Spanish and the physician could not understand the language. So the boy acted as his own interpreter as his mother described his symptoms. When his mother said he was dizzy and pale, the boy translated to the physician saying his mother said he was yellow. Due to this misinterpretation, the boy received inappropriate treatment. What can we learn from this case? Language barriers can cause dangerous effects. Children should not act as medical interpreters, but the interpreter must be skillful in both languages, present messages truthfully, and not alter or eliminate information that he or she feels will upset the patient. Lastly, they must be skilled with medical terminologies and sensitive to the culture.